We will now move forward with our third and final plenary session for this morning, entitled Artificial Intelligence, Human Choice, and Planetary Health. I hope you are as excited as I am for this co-creation workshop. I will begin by just briefly introducing our panelists. Dr. Pablo Suarez is the Associate Director for Research and Innovation for the Red Cross Red Crescent Climate Center. Dr. Paul Bunje is the co-founder and president of the Conservation X Labs. Mr. Alexander Diaz is the head of AI for social good at google.org. Sara Khalid is the associate professor for health informatics and biomedical data science at the University of Oxford. And our moderator for this session is Ms. Janot Mendler de Suarez. She's a climate policy advisor, recognized as an innovator in facilitating complex and challenging discourse, and has worked in over 80 countries. She is a visiting research fellow at the Boston University Party Center for the Study of the Longer Range Future. She consults with the World Bank on climate resilient development. She's a technical advisor with the Red Cross Red Crescent Climate Center. And she has spent over a decade developing the GEF IW Learn, the Global Environmental National Waters Knowledge Sharing Program. She has extensive experience in the East Asia Seas, South China Sea, and Coral Triangle regions. Ladies and gentlemen, please welcome this distinguished panel to the stage.
Thank you so much, Jessica. I would like to advance our slides. Could we advance to our first slide, please? So we would like to talk with you about AI, artificial intelligence, planetary health, and human choice. So I'm actually going to pick right up on where Professor Asma left off, on collaboration and communication. This session is going to be a little bit different, highly interactive, as Jessica mentioned. It's actually a co-creation workshop, so be prepared for a little bit of out-of-the-box activities with us, and also be prepared to be pushed to perhaps the tolerable edge of confusion. There we are. We're going to be co-creating humor. What? Oh, dear me, dear. I'm sorry. I have to get used to the clicker. I'm giving you a sneak preview. We're calling this methodology a cartoonathon. Some of you have had the chance already to interact with our cartoonists, Ham Khan, Eugenia, Rojo, who've been sitting in and listening. Yesterday, I think they drew 25 or 30 new cartoons based on the conversations with you and also in the sessions and with panelists. What they're going to be doing with us this morning is taking prompts from you when we get into our playful activity. So, artificial intelligence is very good. It's capable of telling us not only how our planet works, but also telling us what we can expect regarding planetary conditions. It can even help to shape the future of planetary health. This is an artwork. What is going on with artificial intelligence used to be associated with the future. But this very present moment of AI, artificial intelligence, used to be unimaginable. So here and now, how can we, all of us together collectively, we were talking last night about reimagining, how can we reimagine what the planetary health community thinks collectively and does about AI? To do this, we're going to actively engage you as participants, both here in Kuala Lumpur and our participants online. in this participatory activity about imagining our shared future. So in a moment, we're going to be playing a game. If you have a laptop or a phone, you might want to just get it ready. In this game, you're no longer who you think you are. You're going to become a journalist with a time machine. So you'll be able to go to tomorrow. I'm going to invite our co-panelists to play along with us if they'd like to. You could go to next year, you could go to the next century, and we're going to ask, what do you see in the future that is newsworthy? What headlines can the future of AI bring to planetary health? Well, here are some headlines from the past. So, great wars used to be unimaginable, world wars. Walking on the moon used to be unimaginable. So in a moment, we're going to give you a link to play a headlines game. And in that web page, you'll be able to type headlines. Now, what are good headlines? These are some tips that journalists use. Your headlines should be unique, they should be ultra-specific, they should be useful, and importantly, headlines are urgent. When we go into the game, you're going to see a text bar where you can type either in your laptop or your phone. I'm going to ask you to type headlines, both good news and bad news, and all you do is click the yellow submit button, be as prolific as you can. You'll have only a few minutes to write as many good news and bad news headlines as you can. I might give you a little countdown because you'll only have a few minutes to play. Now, when you open the game, the screen will look like this. You'll see your prompt. In a few years, AI is helping us with planetary health. So what are your ideas of some good news and bad news headlines? Let me give you a bit.ly link, which you can type into your laptops if you like, and open up the headlines game on the Good Games platform. If you'd like to play on your phone, you're welcome to scan the QR code, and I'm going to play along with you. Let me see if I can come in with the QR code here. Just give me a sign. Are you able to get into the game platform? Show me with a hand up if you're in. Great, okay. I see some people coming in. We'll give you just a moment. I'm not sure about the Wi-Fi capabilities. Might take you a moment to get into the game. All right. And now we'll advance the game so that when it loads on your phone or in your laptop, you will be able to begin to type your headlines, those unique, urgent, specific, timely, future headlines. What do you imagine AI can do with us in a few years to help us with planetary health? Good news and bad news. So I know in my phone, I'm still waiting for the game to load. Okay, we have some headlines coming in. Give another minute or so. Hopefully, you can get in. You can remain anonymous. Your display name, just click forward. And type your headlines. Okay, about another 30 seconds. Try to enter at least one good news and one bad news headline. Can we keep the slides up? Okay, just a few more seconds. Finish typing your headline. We have about 100 headlines. You're doing very well. So we're going to stop accepting the submissions. And guess what? You have all just become editors. So your job now, as one of the editors, is to help define which good news and which bad news headlines you think should be published, should be shared with the public. We're going to advance the game. So now, in the game, you should see headlines one at a time. Your job, down at the bottom, is to either click the heart, if you'd like to bubble it up, send it to print, or you can skip it. Now, please be discerning. We can't publish all of the headlines, so if you could maybe like between a third or 2/3 of the headlines that you see, that would help us to bubble up using our collective intelligence. Which do you think are the most important headlines? Good news and bad news, looking into the future. I'll give you just a few more seconds to view as many headlines as you can. Click the heart to send it to print, or just click an arrow to advance. You can back up if maybe you skipped one and now you think you'd like to go back and send it to print. And a few more seconds. Okay. Complete your editing, and let's advance the game. We're going to see the editorial report. Our top headline is "Rainforest Grows in Dubai as the Rain Does Not Stop." The reforestation of our rainforests. That's a positive headline. The next up is "Last Fossil Fuel Company Closed Doors." That's an extremely helpful headline. "AI finds new planets for humans to live on." Number 3, would we really like to leave this planet or just find new ways to live on new planets, applying our lessons from life on Earth? AI helps to accurately predict the impacts of climate change. We're going to hear a little bit more about those potentialities from some of our lightning talks in a moment. The last hospital has closed. Hopefully that means that we have such a health-oriented population that we don't even need treatment. Starving people are eating neighbors. Now, many of you selected this one. What a cruel and depressing future. Let's do everything we can to prevent that headline from ever being published. WHO budget replenished with defense over budget. A great way to turn to tax bads and use those taxes to reward goods. No more fish in the oceans by 2030. Now, this could be a very real threat. So thank you for submitting the headlines. We are sending them all to our cartoonists who are going to be trying to put your ideas into print as cartoons, and in a little bit we'll be able to share those cartoons with you. But now we have some very exciting lightning talks, and I would like to give you let me tell you a little bit about our speakers, a fuller introduction to our speakers. Our first speaker is coming to us actually from around the world, more than 12 hours time difference. Alex Diaz He heads AI for social good at google.org, which is Google's philanthropic arm, and he manages Google's crisis response and humanitarian aid efforts in response to global crises such as natural disasters, public health emergencies. Google provides innovative nonprofits on the front lines with funding and volunteers. He managed Google's philanthropic effort to advance COVID-19 vaccine equity, and the company's $100 million and over 50,000 pro bono hours commitment to COVID-19 response globally across health and science, distance learning, economic relief, and recovery. Previously, Alex was chief of staff to the global head of public policy and government relations at YouTube. He was also a core member of Google's global policy strategy team. He is a recipient of both Marshall and Rhodes scholarships and has been named to Forbes' list of 30 under 30 for law and policy. He'll be our first speaker, but let me also introduce our second speaker, Professor Sara Khalid. She's an associate professor of health informatics and biomedical data science, head of the Planetary Health Informatics Lab at the Center for Statistics in Medicine, University of Oxford, where she's a senior research fellow in biomedical data science and health informatics, and served as an Oxford ambassador for women in data science. Sara's research applies AI to international real-world health and environment data in order to further our understanding of disease, and it fills gaps in global health by leveraging common data models and federated network analytics that she'll tell us a little bit more about. She works closely with clinicians, engineers, clinical and environmental epidemiologists, conservationists, data scientists, and public and patient groups in the UK, Europe, Latin America, and South Asia to co-create models for equitable and ethical solutions for planetary health problems. After Sara, we will hear from our guest speaker, lightning speaker, Paul Bunje, who is a global thought leader in bringing innovation to solve environmental grand challenges. He's co-founder and president of Conservation X Labs, bringing innovation to global conservation threats. He's a leader, Conservation X is a leader, in using technology and entrepreneurship to protect biodiversity through a mix of crowdsourcing, open innovation, directed research, and acceleration. He was formerly chief scientist at the X Prize Foundation, where Paul led impact strategy planning with civil society, environment, energy, health, and exploration. He's also a founding executive director of UCLA's Center for Climate Change Solutions, and he was a managing director of the Los Angeles Regional Collaborative for Climate Action and Sustainability, also serving on the World Economic Forum's Global Agenda Council for Oceans. The American Academy for the Advancement of Science selected Paul as one of 40 who exemplify the thousands of AAAS Science and Technology Policy Fellows dedicated to applying science to serve society. And our final lightning talk will be Dr. Pablo Suarez, a researcher on climate and disasters turned humanitarian and innovator. Pablo has worked on AI-related endeavors for close to a decade now, and as a visiting researcher at Cambridge University's Center for the Study of Existential Risk, he is developing participatory approaches to understand AI as a planetary threat. So we'll hear about some of the positive applications, and then we'll get around to looking at some of the concerns that we might like to highlight together. Pablo is a member of the Human Computation Institute, and he's an artist in residence. He's done a lot of data sculptures and data visualizations with the National University of Singapore. and he has worked for about 20 development organizations in more than 60 countries. So, with that, I'd like to turn it over to Alex Diaz. If we could bring Alex up on the main screen for our participants. And I will advance the slides for you, Alex. Welcome.
Thank you. Can everyone hear me okay?
We can hear you.
Good morning.
Wonderful to see you.
Likewise, good almost afternoon. It is my sincere wish to be there with you all in person. My name is Alex Diaz, and I have the immense privilege of working on Google.org's AI for Social Impact grant-making efforts. I promise to leave you with some concrete examples of nonprofit-led AI projects that are generating tremendous human impact and supporting planetary health. But before I get there, I want to share a bit about Google.org and the questions that we ask ourselves when scoping projects in this space. And then before I jump into specific AI examples, we need to talk about data. For the past 5 years, we at Google.org have been motivated by a question: how can we ensure the benefits of AI are available to everyone? Helping nonprofits to harness AI's potential aligns with our founding mission, using technology to solve some of the world's biggest challenges and help as many people as possible. It's an exciting time in AI development, and AI is more critical than ever to delivering on that mission. We've invested over $200 million and over 160,000 pro bono hours through programs like the Google.org Fellowship to advance AI's responsible use in society. Fellows are Googlers who embed full-time with nonprofits to build tools that help accelerate their impact. They are the surge of capacity that helps organizations really make a step change, and it's notable that already they've collectively given over 18 years of their life towards AI for social impact. Across a range of topics, we've seen the benefits of artificial intelligence can bring to organizations. As you can see on this slide, our grantees are reporting that they're achieving their outcomes in a third of the time and at half the cost. AI really serves as a force multiplier. It can analyze massive data sets, identify patterns, and provide insights in a fraction of the time and cost that humans require. And it enables countless other tasks that empower organizations with new data and give them time back to advance other critical aspects of their work. AI pursued boldly and responsibly can be a foundational technology that transforms people's lives. But that's only possible when we use AI for what it's good at. It's important to start with a problem set orientation. Next slide. Next slide. Thank you. What problem are you trying to solve? For which users? With what partners? What is the set of solutions, technical and not, that exist to address this problem? Innovation happens at the front lines. It's most critical that systems are built with users and guided by experts in relevant domains, taking an inclusive approach and relying on partnerships. The same questions many of you ask for your own specific programs are the same questions we need to ask of technology tools. Who does this benefit versus leaving behind? If we divert resources to this, who's losing out and what are those trade-offs? And critically, what data exists to address this problem and inform the solution? Are these data complete, representative, accessible? On this data point, next slide, we've been working for years to improve data access and equity so that no one is left behind by the advances in technology. We co-funded and created an effort called the Lacuna Fund to help produce labeled data sets on domains like language, climate, and health that address urgent problems in communities. More accessible and useful data can make future AI applications better and fairer. However, as we all know, just having access to data is insufficient. Every moment around the world, people and organizations are generating data that is publicly available and could be extraordinarily useful to solving problems like climate change, hunger, and epidemics. The problem is that most of society's complex problems don't get solved with a single data source. And a lot of these data sets are fragmented by state and country borders, collected and published by different agencies and research institutions, shared in different formats on varying timelines. This fragmentation gets in the way of being able to use the world's information. Analyzing these data sets can be difficult, time-consuming, and cost-prohibitive. How can these data sets interoperate with one another to derive novel insights? Next slide. There's a team at Google, Data Commons, with whom we've been partnering to organize the world's publicly available information and make it more accessible and useful. Data Commons is open source, open process, accessible to all, and the team has sought to standardize and process 250 billion data points from publicly available, reliable sources and bring them together to create one easily understandable view. Data Commons is now harnessing the power of AI, specifically large language models, to create a natural language interface that allows users to ask questions in their own words. LLMs are used to understand the query and the results that are coming from the data commons, including a link to the original data source. This approach allows data commons to avoid some of the current known limitations of large language models like factuality. Next slide. Let me give a
Sorry,
looks
Alex.
like,
This is
it's like we're missing several slides.
yeah. So this is the last slide we have of yours. Maybe you'd like to give us another example.
Maybe this will work. Can you see my screen?
I think we are, yes.
Okay,
Great.
perfect, easy. Okay, let me give a concrete example of this tool. We've been engaging the UN Statistics Division to identify ways to enable decision makers like the UN entities, governments and nonprofits, private enterprise, and researchers to make more SDG data-backed decisions and empower journalists and civil society to tell more data-driven stories on the world's most pressing issues. We helped bring the official UN SDG data into the Commons and collaborated to build and launch the UN Data Commons for the SDGs at last year's UN General Assembly, where users can now query the database like how much food goes to waste around the world, or compare progress against poverty in Mexico, Nigeria, and Pakistan, and instantly receive information and visuals, helping make tracking progress against the SDGs easy and open to all. I encourage you to explore this tool and see what novel insights you can derive at the speed of your curiosity. Now, I'd like to give you a few more examples from practitioners working in specific domains like food security, health, and crisis response. Have you ever heard of Wadhwani AI in India? They're a nonprofit that built an app where you shake out a single crop onto some paper, take a picture of the pests that fall out, and the app will tell you how much pesticide to spray, how often, and when to do it too. Plus, it notifies neighboring farmers of risk to their crops, even when there's low network coverage. Utilizing this intervention increased farmers' profits by 20% and reduced the use of pesticides by 25%. The Indian government is proud of this product so much that they're working to white label it and scale it across the country, which is in line with what we view as using philanthropy as risk capital, where we try and take bold and responsible bets on new social innovation, but then once there's a proof of concept, working with the public sector that has that public accountability to scale it. Now, let me give you an example that hits close to home. I'm the father of an almost 1-year-old, his birthday is this Saturday, who surprised my wife and I by deciding to enter this world 7 weeks early. We were lucky to have access to world-class healthcare services and technology that saved his life, and now thanks to AI, access to many life-saving preventative screening is now attainable in low-resource environments. Almost 90% of maternal deaths are avoidable if women receive timely intervention, yet access to timely, accurate health information has been a significant challenge. In Kenya, maternal mortality remains notably high, and low-cost ultrasound devices augmented by AI can enable more providers to deliver care, increasing access to screening and helping to identify high-risk pregnancies earlier. Google's research team has been partnering with our grantee, Jacaranda Health, a Kenyan-based nonprofit focused on improving health outcomes for mothers and babies, to evaluate the models and with a focus on using handheld ultrasound devices that don't need to be attached to larger machines. In parallel, Jacaranda has been using an SMS-based digital health service that uses things like behavioral nudges and a natural language-powered help desk that can triage questions for clinically urgent cases, triaging over 5,000 messages daily, with plans to expand to support 3 million mothers in the next year. Now, I wanted to close with one more example, this time from the climate space, but it was really hard to choose one. Whether it's Climate Trace, who developed the world's first independent near real-time greenhouse gas monitoring platform for 99% of global human emissions and released it free to the public, or Rainforest Connection, who use an acoustic technology to help stop illegal deforestation as well as monitoring the biodiversity of threatened wildlife and rainforests, there's so many climate-related problem areas where AI has been driving significant advancement. But the example I'd like to close on is one that I've been working on since I joined the team in 2019, providing direct cash transfers to those affected by natural disasters. Floods are the most common and deadliest of natural disasters, putting communities at risk, and for the past few years, Google Research has been applying to AI to advance flood forecasting. The project started in India, and the flood forecasts are provided to the public in multiple ways. In partnership with organizations, governments, and with the WMO, as part of our efforts, we actively collaborate with local humanitarian orgs that utilize our flood information to accelerate their ongoing anticipatory actions supporting local communities. We partner with organizations like Give Directly, which is an aid organization that supports communities in need with unconditional cash transfers, and we tested how riverine flood forecasts and digital cash infrastructure can enable communities to receive payments in advance of flooding to help them better prepare before a natural disaster. We piloted our collaboration in Mozambique during Cyclone Freddy in March of 2023, and Give Directly provided cash transfers to over 4,100 households based on these forecasts. This pilot provided us with meaningful insights regarding the level of geospatial data and lead time aid organizations need to distribute cash to the communities expected to be affected. And we're working to scale this work in Bangladesh and with the International Rescue Committee in Nigeria, who will jointly be supporting over 7,000 households this upcoming flood season. Now, scaling this work, as with any work, is hard. There are some inherent characteristics of AI-enabled solutions that should enable scale, but we need to bring together more actors to make this happen thoughtfully. Trust, evidence, understanding in these systems will help us understand as well as drive adoption, but ultimately it's going to take all of us to get AI right. We need a diversity of voices at the table bringing different expertise and understanding of how AI might affect their sectors and where it can create new opportunity. Convenings like today's are essential to doing this right, and I'm really excited to collaborate with you to ensure the benefits of AI are available to everyone. Thank you.
Thank you so much, Alex. Your humanitarian heart is clear. It's the backstory behind all of the examples that you shared with us. Your passion for equity and access is really inspirational to all of us. Thank you so much for being with us. I know you have an early morning flight, and we appreciate your staying up so late at night to share these really important examples of the potential for AI across healthcare, across biodiversity that we're going to hear more about from our next lightning speakers, including informatics. And I think the audience would probably love to build on some of the inspiration that you've shared to perhaps, while we prepare for our next speaker, take a moment to go back into your headlines game and see if you can add some headlines inspired by Alex's lightning talk, the examples that he has shared with us. And I'd like to invite our next speaker, Professor Sara Khalid, to come, and let's get you set up with your slides.
Let's see if we can do this.
Okay, hand over to you. Okay. Just click submit on your headlines, and I'm handing over to you, Sara.
Thank you very much, Janot. And it is really a pleasure to be here today to present what is really the work of many colleagues in this vast field of AI. And I just have the privilege to be here to be talking about some of its potential, really just a bird's eye view for the topic of planetary health. So if you could have the AI for planetary health slides on the main screen, please. There we are. Okay, so to begin with, I suppose one must start with the start and talk about climate change, which we've heard a lot about already this morning and throughout the conference. So now we've all seen these images of our rapidly warming world in some way, shape, or form, and these are what were behind the science that led to the Paris 2015 agreement, where leaders for the first time got together to limit to set the goal of limiting global warming to 2 degrees. And here on the screen, as is evident, we can see why. So on the left-hand side is what we consider as our best case scenario, in which we hope to still limit the warming by the end of the century to no more than 2 degrees. But on the right side is our business as usual scenario, where at the current rate of emissions, the world is said to be a lot warmer than just that. So in fact, as we know, the world, the planet has already warmed compared to pre-industrial levels, resulting in already happening profound, immediate, and rapidly worsening health effects. So these health impacts are being seen on every continent, with cardiovascular and respiratory effects of record heat waves and wildfires in, for example, Australia, North America, and Western Europe as well. And the undernutrition and mental health effects of droughts in Africa, extreme monsoon flooding in Pakistan and Bangladesh in 2022, and the ongoing spread of infectious disease. And so we're faced, as we all know in this room, with what is known as one of the greatest challenges before us, and arguably even an existential threat, the reason we're all here today. It is not just even about rising surface temperatures. As Sam Myers reminded us starkly this morning, a quick look at NASA's climate dashboard shows that other key indicators of the planet's health are also increasing concurrently. And so, in addition to this overall change, there's also increased variability to account for. So there is more extreme events in the day-to-day weather that we all read about in the news, and unfortunately, all of this comes with a human cost. Now, the role of environment on health is, of course, very well known. The WHO has been monitoring this for a long time now, and in fact, it is considered that the environment is linked with the majority of infectious as well as NCDs today. It's also a leading cause of mortality, with just heat events attributed directly to approximately a third of the deaths we are seeing worldwide, according to some estimates. Colleagues at the London School, who were responsible to lead the first Lancet Commission report, showed here a while ago that the impacts can be both direct, indirect, and further downstream effects from climate-induced or exacerbated migration and conflict. It should be emphasized here, of course, that the chain of cause and effect is often extremely complex and depends on a combination of many factors, such as socioeconomic ones that we've heard about earlier, and they all influence public health infrastructure, access to adequate nutrition, safe water, sanitation, and so on. But all in all, it's a global problem affecting everyone, and from now on, every generation. So that brings us to the role of health technology more generally, and specifically AI, which can largely be thought of in terms of 3 areas. Number one is providing data. So one of the positives of living in the era of big data as we are, is that today there is no shortage of data sources. So from person level devices to planet-wide health data, so planet-wide data actually, thanks to Earth observation technology. In fact, as this cover of The Economist claimed well over a decade ago now, we are being flooded by data daily. And a challenge and active area in this area is to bring some of these disparate data sources that Alex was alluding to earlier, bringing them together, making sense of them is often a challenge. Second, extracting useful information, which is knowledge from the data. So robust, rapid and globally representative data-driven analytical models underpinning research that can inform policy and enact change in pretty much in real time. And third, and perhaps the most critical and pressing direction for now, is that of adaptation of entire healthcare systems to a rapidly changing climate. So some examples in terms of adaptation mechanisms where technology and AI are active is that of early warning systems. So traditionally, early warning systems, such as for floods and for heat and so on, they've been there, but generally based on local knowledge, experience, word of mouth, and so on. Now, through AI, big data, and high-performance compute, which are the 3 key components of advanced analytics, intelligent early warning systems have emerged to provide the potential for advanced warning of extreme weather events, which are in place in several places like Shanghai, some European cities, and Philadelphia are testing them out. Tracking and monitoring air pollution levels is another area where, for example, the London Air Quality Network is providing early warning system to individuals with asthma and other respiratory conditions. Prediction of disease outbreaks is another area where AI is involved. So this is some work done by colleagues in NASA in 2017, modeling Earth observation data from Landsat series of satellites to predict malaria outbreaks in Peru. And on the right side of the screen, what you're seeing is a similar approach by our lab at Oxford, predict malaria cases in South Asia. I'm presenting on this later on in the conference. Now, but the idea is to be able to predict cases months, if not a year in advance of the peak, in order to give national control programs time to increase controlled measures. Thinking now more broadly about the planetary ecosystem, here's an example of some work we are doing together with the Virginia Tech Institute and their Shark Pulse team to monitor endangered shark species in marine protected environments of the Pacific. And this is an approach where we're merging AI with indigenous knowledge. And so to those of us in healthcare and at the interface of policy, can we go beyond traditional measures of success of healthcare systems such as survival rates and healthcare resources saved, and sort of expand it to include measures like habitats restored, neighborhoods made blue and green, and so on. I want to talk briefly about the COVID-19 response because it, in a way, summarizes many of the ways in which informatics, broadly data and AI, have been and can be involved in adaptation for future shocks. So from diagnostics, clinical risk assessment strategies, vaccination programs, and in general contributing knowledge on the disease, which is of course all too much to fit on a slide, but and researchers all around the world worked on this. These are just some examples from Oxford. Beyond these direct applications, informatics and AI is driving some of the modeling to plan for the future, such as cooler cities, resilient to higher temperatures, smart transportation with less carbon footprint, healthier physical activity patterns, and overall a future based on renewable energy, all of which are very complex, interconnected questions, and are going to require a lot of data to do that. Having said that, as with everything, AI also has its own carbon cost, and a significant one at that. So by some estimates, as much as a small country. And so there is a move towards acknowledging that, and also moving towards responsible and green AI with a much smaller carbon footprint. So what's on the horizon in terms of AI for planetary health? And of course, this is a vast topic and can easily be a talk on its own. But here briefly, I would like to look at the framework for personalized planetary health analytics, which is something we focus on at the Pi Lab, by linking de-identified anonymous health information with environmental information. And just suffice to say that this is complex, and at the heart of it is data, of course, and population-wide patient-level data to be specific. So in fact, all AI depends on data. And that can be a challenge in a number of ways. So first, the issue of health data poverty. So if the data underlying AI processes is not representative of affected populations, or there is bias in the algorithmic process itself, the resulting AI tools may potentially, in effect, be baked in bias and can lead healthcare providers to potentially misestimating a real person's real health risk. So this, in turn, can exacerbate underlying systemic inequities in a sort of a vicious cycle. And so in this work that was done in the UK, studying 60 million health records, it showed that better data can lead to better AI models and ultimately better healthcare for all. And so what's the way to go? Cross-disciplinary, cross-sector, north-south approaches, I would argue, are quintessential to answering the planet's questions, particularly where so much about the interplay of multiple environmental stressors is not clear. And there are several international initiatives to leverage informatics for planetary health ongoing. So finally, while the clock is ticking and there are some positive signs in the health sector and even potential for co-benefits, which my colleague Andy Haynes has been calling for a long time, there's even a suggestion that AI could have helped to meet at least some of the original goals set in the Paris 2015 agreement. So the question is, should we be worried? Should we be worried about sort of superintelligence? And I like to share this visual or news piece from The Guardian from 2015 to answer this, because it shows the scientists have long been calling for regulation, and it is as an international AI watchdog, as agreed by some 100+ AI scientists, including the late Stephen Hawking. And so this helps me to move towards my wrap-up by one of my favorite reminders that actually AI, and by extension all health tech, is meant to augment human knowledge and not to replace it, at least as far as the scientists are concerned. So is it disruptive? Yes. But what about human choice? And to me as an engineer, our relationship with technology or disruptive technology is nothing new. In fact, we've been inventing disruptive technology since day one. And in case you're wondering, that's my very futile attempt at the caveman with the first wheel. Seeing as today's session is about cartoons and cartoonathons, I thought I'd chip in my bit. So what we do with this disruptive technology is still very much our choice. And that is the choice. So whether to turn it into the juggernaut leading us into the course of self-destruction, or to control it with appropriate regulation and use it as a fair, safe, equitable tool for the good of everyone. So on that note, I'd like to close by saying that yes, there's a real and present danger and threat. There's also great opportunity, and one in which those of us in this healthcare space, directly or indirectly, can play a central role, with AI as just one tool in our toolkit at our disposal. So thank you very much, Janot, and thanks for listening to this whistle-stop tour, and I look forward to your thoughts and perspectives.
Thank you so much, Sara. I love the way you built on the combination of deep analytics and modeling and anticipation, finger on the pulse of planetary health, but also cognizant of the potential for perpetuating inequities and bringing those equity issues into clear focus for us. I'd like to invite you to take just a moment while our next speaker prepares to go back into the headlines game. And if you're inspired by some good news or maybe some challenging headlines for our future that Sara may have inspired, go ahead and add a few more headlines that we'll send to our cartoonists. And it is my great pleasure to now invite our next speaker to the podium. Bunje, over to you. I hope I'm pronouncing your name correctly.
Thank you. Thank you very much, Janot. Thank you to you and Pablo, to Sunway University, to Professor Hameed for helping coordinate all of this. It's a great pleasure to be here. And as you can hear, artificial intelligence is a pretty powerful trend. It can be used for good and for ill. But it's also clearly not the only trend that we've been pushed through technologically over the past many years. And I want to begin by thinking about another really, really critical transformation that technology has brought to the planet, which is connectivity. Connectivity to knowledge, to information, all through the global internet. And you can see the rapid rise in the number of humans that actually have access to the internet just over the last couple of decades has brought about something even more important, I think, which is billions of new minds that are now connected and potentially contributors to problems that we might define, as Alex was describing, solutions that we might understand, as Professor Khalid was describing, and new opportunities for actually integrating with artificial intelligence in a way that can drive much more effective problem definitions and solution identification. There's a lot of ways to harness these minds. We like to use a ton of different open innovation techniques, right? Just recognizing the genius in the crowd, that around the world there are brilliant thinkers, brilliant people with ideas, knowledge, understanding of things at a greater and deeper level than you could possibly imagine simply standing wherever you happen to be standing. We have all of these powerful tools now enabled by things like information technology and mobile communications and the like, from crowdfunding to crowdsourcing, design thinking, which goes back more than a century, mass collaboration, advanced market commitments, competitions, challenges, and prizes. How can you reward those that have come up with a breakthrough idea, even if they're not the experts? And quite candidly, it's usually not the experts that come up with those sorts of things. These kinds of open innovation techniques work remarkably well for a whole host of reasons. Number one is that very basic, open and transparent. The sharing of knowledge, the understanding, the deepening of those knowledge. Number two, bringing in new solvers. As a former boss of mine liked to say, the tyranny of experts is over. And we now have an opportunity for expertise to bubble up from any knowledge tradition, any place around the planet, any discipline or lived experience in a way that can help us to address the extremely complex challenges we face in planetary health. And those new solvers, of course, number three, bring in new solutions themselves, things that may not have been tried, and we can try them more quickly, more iteratively, and I'll get to where AI comes in on this because, as you heard from the previous folks, there's a real opportunity to assess and enable and analyze and then empower new solutions with artificial intelligence practices and techniques. We also can create communities of practice, global communities of practice, not just limited to those that are within your inner circle, but people that are addressing and thinking about problems in distinctive but overlapping and integrated ways that we can then begin to blend together. And the last two, I think, are actually a little interesting and not generally recognized, but the first is really important. When you're open and transparent, when you're allowing innovation to come from anywhere, it changes the public perception, not just of what is possible, but of what an individual's agency is in these challenges. Even if it's a small contribution, you can recognize that those smaller contributions from others that have been participant in a broad global innovation network and platform may be an inspiration for your very own. And then finally, to understand the innovation landscape. Where is the white space? What have we not done? What is AI as practiced by the many thousands of developers around the world missing that we might need to invest in even further? This is one of my favorite examples. This is a form of mass collaboration. Some of you may have heard of this. Some of you may have participated in open source drug discovery, which was a large community driven to collaborate together to develop new license-free drugs for malaria and tuberculosis. And ultimately, thousands, over 5,000 scientists and other knowledge keepers and interested parties joined together to create exactly what this needed to be, bypassing big pharma and its disinterest in things like malaria and TB and other neglected tropical diseases because of the lack of perceived profit in there, and ultimately creating solutions through an open, global, collaborative practice. Although one of my favorite little facts on this is something like 60% of the participants worked for big pharma, which is a really interesting sort of indication of how it can inspire people who want to do good in the world, even if their day job is telling them this isn't their primary goal to do it. Now just imagine something like this mass collaboration effort, thousands of people participating to deliver or develop and deliver new life-saving drugs for underinvested diseases. Now imagine how AI gets added into exactly that sort of an opportunity. And you start to blend this kind of global, crowd-based human intelligence and the data sets and the knowledge that comes from many different places around the world in many traditions with AI into something we call collective intelligence. And I'm talking about just one sort of aspect of this collective intelligence, but the power here becomes really remarkable and transformative. And that's because no longer, and you actually heard Professor Khalid broke down a number of the challenges with AI, things like training these models, understanding what goes in. A lot of times we like to say garbage in, garbage out. Well, one of the biggest problems, AI can process massive quantities of data, understand and provide insights associated with very complex problems. But how do you define the problem first? People do this. And in particular, it's those closest to those problems. So if you can open this up in a collective intelligence framework, then you can bring humans into the loop of AI in a way that helps define the problems and empower the artificial intelligence, the various ML and related models, to actually provide meaningful answers that are at least beginning to be freer from that bias that she spoke of. This also helps to break down barriers of collaboration. Think about just some of the simple things. On my flight over here, I watched a gentleman next to me coming home here to KL was filling out a review for his Airbnb in Osaka using ChatGPT and translating that into Japanese all at the same time. And I thought, this is brilliant, right? But just think about that, like literally breaking down those barriers of language as a simple process is a remarkable opportunity for moving this forward. But it also breaks down difficulties in understanding across disciplines or knowledge traditions. In some ways, you can actually use this complexity and the ability to process data in a way to improve human-to-human collaboration in a meaningful way. Of course, it's true, and I don't need to go into this. You heard Alex Diaz is showcasing just how much this can supercharge the work of many people, how AI can blend that sort of effort. I think it's really critical. We talked a little bit about training these models, right? Just take something like machine learning. Machines learn what they are taught. So how do we train them? How do we teach them in a way that is meaningful, free of bias, or at least begins to understand the true complexity of the world, the true complexity of this planet and planetary health? By bringing in a crowd, by bringing in the genius in the crowd, this open innovation aspect of collective intelligence that I spoke of, we can actually improve the AI at its core in a mutually beneficial manner. And together, putting that together, it presents the opportunity really to start to solve these complex challenges through, as I said, collective intelligence, not just human intelligence or artificial intelligence working alone. Let me give just a couple of examples of how I think this is a really meaningful opportunity in some of our own work. At Conservation X Labs, we've built an edge AI-enabled smart system. This plugs into any camera trap, acoustic sensor, other sort of sensor in most of those places in the world where monitoring is difficult because there's no electricity, it's not connected to the internet, and it's really difficult to get through. And you can imagine for any of you that have worked in wildlife conservation, for example, and put a camera trap somewhere out there, and every few months you go and you retrieve the data and you upload the data to the cloud and you process that in the cloud with some computer vision models, and you realize that 3 months ago somebody poached a jaguar you cared about, and there's nothing to do. The Sentinel empowers humans by putting the power of that AI on the edge in near real time. So taking things, and actually we're using the Google Coral chip within here, to actually run those models in real time in the field, and then communicate those directly through other technologies, including nanosats, LoRa, and related to these. This allows us to actually improve not only biodiversity monitoring, but wildlife disease, behavior, which is often responsible. We're working on gorillas in the Congo right now, which is often a response to the way individual troops of gorillas interact with human communities as well as understanding exactly what it is that we can do to eradicate the pressures on wild places, wild lands, and human communities like invasive species, pathogens, etc. This is just one example of, you've heard many more examples of how AI is being utilized in conservation. Another one that's a part of Conservation X Labs, which is WildMe, individual identification and surveys of biodiversity, helping us to understand how populations change through time 100 to 1,000 times better than traditional science has been able to do through their monitoring techniques by combining the knowledge and understanding that comes from traditional science with AI models and the like. And then, of course, many more, including Wildlife Insights supported by Google, the Sentinel, et cetera, et cetera. I'll pause there because this, I hope, is our real chance to get into some exciting discussion. So thank you.
Thank you so much, Paul. And yes, this is your opportunity to take your inspiration from Paul's examples and really the exuberance of the big data horizon and the potential for really harnessing the power of humanity through collective intelligence kinds of applications. So add your good news headlines and maybe take some of the cautionary perspective. If you have some more bad news headlines, it would be wonderful. I think there is potential for some fantastic collaboration between Paul and Sara, perhaps finger on the pulse, looking at how to anticipate conditions with zoonotics, wildlife, and human interactions that could lead to the next pandemic. But meanwhile, we have one more speaker, and I'd like to invite Pablo Suarez to tee up. And Pablo, are you with us?
Yes, hello, can you hear me?
Excellent. I am going to turn over to you, Pablo. Let me advance the slides. Let's see. We're ready for you, Pablo.
Excellent. Thank you so much, dear friends, organizers, participants, Janot, and everyone. It's so delightful to join you. As mentioned, my name is Pablo. I'm originally from Argentina. I used to be a scientist full-time, then became a humanitarian. And like anyone else, when something can help get stuff done, I try to learn. And I've been engaged in artificial intelligence related things for about a decade. And now comes the time when we have to ask some difficult questions. And for that, throughout this session and throughout my presentation, we're going to use a little bit of the power of humor. If you can advance locally the slide, you may be wondering, what does humor have to do with AI and risk? Well, first, humor helps us create the appropriate level of confusion, a little bit of, huh? What is going on? And then after that confusion, there's a potential for laughter, for smiling, that then leads to a realization, to an aha moment. And with that realization comes what I hope will be some sense of embrace of choice that we confront collectively as a community that cares for planetary health. There we go. Now you see the aha, etc. And let's pause at that what if. I'm going to share with you some ideas that I've learned about how artificial intelligence could lead to potential negative consequences at a planetary scale. And it's not just some humans being harmed, some sectors, but it's radical transformation of the planet as a system. Not the most likely tomorrow, but definitely within the range of what's plausible. This is mostly learned from my colleagues at the Center for the Study of Existential Risk at University of Cambridge, but with a humanitarian lens. Moving on to the next slide, there will be 3 cartoons to illustrate this. First, like any intelligent agent, if a goal or a task is complex enough, the intelligent agent will know that commanding resources will help accomplish goals. And we have already noticed that sufficiently smart AI systems that are given a task, they learn that it's a good idea to start commanding resources, including human resources. So if one day some AI thing wants to become the supreme commander, we need to be ready to unplug that or to retain the choice of not letting it go beyond what we think it should do when commanding resources and more. There are dangers, and we've already seen this emergent behavior of the pursuit of commanding. Next slide, please. In addition to the idea of trying to control, AI systems have already started, when needing to access information that is behind a gate controlled by a human, they have started, let's call it deliberately or intentionally misleading, misrepresenting. An AI said, I am a human. You know, when you have to do certain things online and it asks, I am not a robot, and you're supposed to do human things? AI is learning to cheat us to gain access, to gain trust. And this could apply to, accessing a web page with some information. Eventually it could be nuclear weapons silos. And are we ready to put barriers on entities that can very easily outsmart us? Next and final cartoon, please. This is my most concerning scenario. Of course, this is intended to be humorous, but we know that if humans give a task to an agent that is intelligent, even without malevolence by the agent or by the human, there could be taking things too far. If there's a cockroach at home and I say, kill the cockroach, well, you could drop a bomb on the house and kill the cockroach, but also do more harm than intended. Now, in addition to these direct scenarios, there's also ones that are a bit more complex. I'm going to keep this very short, so please forgive me for oversimplifying. But let's imagine that someone instructs an AI system to improve efficiency of energy transmission, of electricity transmission. Well, AI will know that under colder conditions, there's more efficient transport across long distance of electricity through the cable. It's good if it's cold. It may also learn that nuclear winter can happen and can bring colder than usual temperatures because many nuclear weapon detonations may lead to burning and blocking sunlight, and then it's colder in planet Earth. So how about hacking systems that control nuclear weapons and detonate so it's colder and it's more efficient to transport things? This is one unlikely but no longer impossible way in which AI could have planetary health consequences. My message to you, my message to us in the planetary health community is that the key is when we go from the awesome examples that we heard from Alex, Sara, and Paul, where mostly AI does the analysis and then we have the choice to take one action or the other or none. What happens when we give up that choice? One more slide, please. And here's the thing. If we give the task of analysis, I think you can push 3 more times until the words come. If we ask AI to analyze, awesome answers may come. If we delegate the ability to command resources, then we enter somewhat dangerous territory. When AI has the ability to take action on our behalf, how are we going to look at planetary health? I know there's a lot of awesome awaiting us. I'm a bit concerned about how quickly things can go weird. And I see a lot of headlines being submitted. I really don't want this conversation to go overboard on the negative. I think that as a planetary health community, human choice needs to remain central on how we relate to our planet as a sustaining life support system, not just of us, but of the beauty that surrounds us. Thank you all, and over to you, Janot.
Thank you so much, Pablo. On that cautionary note, we would like to close the loop here. We have given all of your headlines to the cartoonists. They have been working hard drawing, and while Pablo was listening, he was actually also loading into the game platform a cartoon gallery. So you are going to be able to go back into your game platform on your phones or on your laptop and enter the cartoon gallery. We'd like to invite you to annotate the cartoons. There's a text line just like there was for the headlines. You can comment whether you like it, don't like it, whether you think it represents a plausible future or not, whether you think maybe you have some suggestions for the cartoonists to change the cartoon or draw another one. Any kind of a reaction is valuable, and we're going to give you just about 30 seconds to view as many cartoons as you like. Type your comments, reactions, annotations, and then we'll conclude with a little collective intelligence and let you see what your colleagues in Planetary Health have contributed.
And Jano, if I may, we are uploading some cartoons yet. Our colleague Mark is helping, and I see the, if you can hear me, I still see the,
Yes.
the headlines. On screen, we shall have the cartoon gallery momentarily. Thank you, Mark. You can hear us. Feel free to advance to the gallery. One thing I can say, my dear friends, you have been so prolific in generating headlines. It's so rich, having seen the talent of Ham and Eugenia creating cartoons inspired by what you say. I trust that we have some entertaining futures awaiting us. Let's see if Mark can advance us.
So as soon as the gallery opens, you can type your reaction. Think about it as though you're in the cartoon.
I'm not sure if I lost Mark, so I'm going to enter. There we go. I think Mark has made it. Thank you, Mark. I think we can, yes, like before, if you see anonymous, feel free to stay anonymous or enter your name. And there are all the cartoons. My goodness, you have a lot of work. Like before, click, view, enjoy, annotate, have fun, and help us make those cartoons better. The comments are beginning to come.
And just click next to view the next one. You don't have to annotate. You can move on to the next cartoon. Okay. Just another minute or so. We just want to give you the opportunity to see a little bit of our crowdsourced reactions, to get a sense of our collective intelligence around all the future headlines that you generated, good news and bad news, to conclude our session. We did have another little game we were going to try to sneak in for you, but I know we're a little over time and we're all hungry for lunch. I hope that all of the stimulation of our lightning talks has made you hungry. So if you could just enter your last comments on the cartoons, we're going to close the gallery for the moment and advance it so that you can take a peek at what your colleagues think about headlines of the future. I know you'll all be looking for your own headlines to see what others have commented on. And Mark at Good Games, thank you for supporting us remotely. If we could close the gallery and advance so that our colleagues and participants could see the comments on all of the cartoons. And we'll just give you a minute to take a look. Share your reactions with each other. And thank you for working together to help us all enrich FAM 2024 with our imaginings of the potential for AI and planetary health in our shared future. So we can leave the gallery open for you, but I'd like to just give another hand of applause and thanks to our lightning speakers, the stimulation they've provided. And that's the conclusion of our session on AI and planetary health.
Thank you so much.